How is technetium-99 used in PET scans to detect abnormalities? That is the question we are going to be answering today. But before we do that, we need to understand what a PET scan is. PET scans are a nuclear medicine imaging method, which basically just a way of getting a look at the abnormalities in your body. But it is non-invasive and it's different from others because it uses the in vivo or the in the living organism metabolic activity using radio tracers. And the radio tracer that we're going to be looking at today is technetium-99. It was originally discovered by Michael E. Phelps to study the brain and the heart, but now it is mainly used for the study and treatments of tumors. PET scans represent one of the most sophisticated nuclear techniques of the last years, and yes, I said the last years because it is a newer way of taking images of abnormalities in your body. What does technetium-99 do in the process of PET scan imaging? Well, the radionuclide or radio tracer is administered into the vein through an IV, and the PET scanner slowly, through the IV, so there's my IV, and the PET scan slowly moves over the body that's being examined. Through the radionuclide, the positrons are emitted by the breakdown of it, and the gamma rays are produced during the emission of positrons. And the scanner detects the gamma rays, a computer analyzes the gamma rays, and uses information to create an image map of the organ or tissue being studied. The amount of radionuclide that is injected into the patient affects how brightly the tissue appears on the image and indicates the level of organ or tissue function. This is what happens to the radio tracer when it goes through the beta decay to produce the gamma rays and let off the positrons. Molybdenum-99 is transformed into technetium-99 by letting off a positron and an electron, and the positron is what gives the signal to the computer of what's happening, and also uses the gamma rays that bounce off of stuff, and they can pinpoint the exact location that the gamma rays are coming off of. What are the pros and cons of continuing to use this technology? Some of the pros are the scans are able to detect the diseases before symptoms and signs even show, so they are more effective compared to other imaging tests. PET scans also can be used as an alternative to biopsy and other exploratory surgeries performed to determine how far disease has spread within a patient, because it uses the metabolic functions of a patient, wipes out the whole aspect of infection from the surgeries. It can also show a difference between non-cancerous tumors and cancerous tumors, and compared to CT scans, PET scans use less radiation and are therefore less harmful to the patient's body. Some cons of continuing to use PET scans and radio tracers do that. Even though the radioactive elements used in these scans are short-lived, it might cause some complications, especially in pregnant women, but that's to expect with any kind of radiation, like x-rays and stuff like that. There's also a number of times that one can undergo the PET scans because of the patient's exposure to the radioactive rays, and of course they aren't necessarily good because any exposure to radiation is a good thing on your body, and it is expensive compared to other imaging techniques. So if you're looking for just a cheap little scan, PET scans are not the way for you. The public safety aspect of using radio tracers, exposure to harmful radiation is minimal during this process, but it can cause DNA damage and cancer, but is highly unlikely because again, the exposure is very minimal. Personally, I feel like the overall impact of PET scans in the community is positive. Yes, you do get exposed to a minimal amount of radiation. You gotta be careful about how many times you do it, but the benefits of PET scan imaging outweigh the risks of the radiation exposure to me. That's just a personal thing. Maybe you think differently. I don't know. If you're really worried about radiation stuff, then maybe it's a no-go. Again, it's expensive, so that can also be a no-go for you. But if you want to go the safest route, meaning immediate safety, so like not making sure there's not infections and like after surgeries and stuff, like that's a big cause of death in people as infections after surgeries. Because it's not invasive, there's no surgery to get infected. So there's just like so many positive elements of using PET scans rather than other imaging methods. Cool. I hope you enjoyed it. I taught you a little bit about PET scans and radio tracers and technetium-99, and I hope you had a good day.